Sperm leakage simply means that semen comes out of the vagina after sex. This is a common occurrence and nothing to be alarmed about. This is a completely normal physiological process. Many couples experience this, and it does not indicate any health issues or problems with fertility. It's important to remember that semen and sperm are not the same things. Semen is the fluid that carries sperm, but it also contains other substances that play crucial roles in reproduction. Semen is the fluid that carries sperm. It's ejaculated during orgasm. This fluid is essential for the transportation and nourishment of sperm cells. Semen is made up of various components. These include not only sperm, but also fluids from the prostate gland and seminal vesicles. These fluids provide the necessary environment for sperm to survive and function. These components include sperm, fluids from the prostate gland, and seminal vesicles. The prostate gland produces a fluid that helps to nourish the sperm, while the seminal vesicles add a sugary fluid that provides energy for the sperm cells. When a man ejaculates inside the vagina, millions of sperm are released. This massive release increases the chances of one sperm successfully reaching and fertilizing the egg. These sperm begin their journey towards the egg. They must navigate through the cervix, into the uterus, and finally to the fallopian tubes where fertilization occurs. However, only a small fraction of sperm actually make it to the cervix. The journey is challenging, and many sperm do not survive the trip. The cervix is the opening to the uterus. It acts as a gateway that sperm must pass through to reach the egg. The rest of the semen, along with any sperm that don't reach the cervix, will naturally flow out of the vagina. This is a normal part of the process and does not affect the chances of conception. The body has mechanisms to ensure that the most viable sperm have the best chance of reaching the egg. Understanding this process can help alleviate concerns and misconceptions about fertility and reproductive health. It's always a good idea to discuss any questions or worries with a healthcare provider. Education and open communication are key to maintaining reproductive health and well-being. Don't hesitate to seek advice and information from medical professionals. For more information and to stay updated on reproductive health, subscribe to our channel and visit our website. Your health is our priority. Yes, sperm leakage after sex is completely normal. It's a common experience for many couples and nothing to be concerned about. It does not mean you are doing anything wrong. In fact, it's a natural part of the process. It also does not mean there is a problem with your reproductive system. Both men and women can experience this, and it's a sign that your body is functioning as it should. Many people believe that a woman must hold in sperm after sex to get pregnant. This is a myth. The reality is that sperm are designed to swim towards the egg on their own. The vagina is not designed to hold fluids in for long periods. Its primary function is to facilitate the movement of sperm towards the egg, not to store them. Gravity plays a role in sperm leakage. When you stand up after lying down, gravity naturally pulls fluids downwards, including semen. This is why you might notice leakage when you get up after sex. It's simply the effect of gravity at work. This includes semen in the vagina. The semen that leaks out is just a small portion of the total amount. The vagina is also designed to self-clean. It naturally expels fluids and cells to maintain a healthy environment, ensuring that it remains in optimal condition. This self-cleaning process is crucial for preventing infections and maintaining overall reproductive health. So, if you experience sperm leakage, rest assured that it is a normal and healthy part of your body's natural functions. The shape of the vagina and the position of the cervix also contribute to sperm leakage. The female reproductive system is a complex and intricate structure designed to facilitate various functions, including the passage of sperm. The vagina, cervix, and uterus all play crucial roles in this process. The vagina is a muscular canal that tilts backwards. This backward tilt can cause semen to pool in certain areas, making it more likely for some of it to leak out. The angle and shape of the vaginal canal are unique to each individual, which means the extent of leakage can vary from person to person. The cervix is located at the top of the vagina. It acts as a gateway between the vagina and the uterus. During intercourse, sperm are deposited near the cervix, but not all of them will make it through this gateway. The cervix itself has a small opening, which can further limit the number of sperm that pass through. This means that even if you lie down after sex, some semen will naturally flow out. Gravity plays a role here, as the backward tilt of the vagina combined with the position of the cervix can cause semen to leak out, regardless of your position. It's simply a matter of physics and anatomy. The laws of gravity and the physical structure of the female reproductive system work together to cause this leakage. It's a natural and normal occurrence. It's important to remember that sperm are microscopic. Despite their tiny size, they are incredibly numerous and resilient. Each ejaculation releases millions of these tiny cells, all with the potential to fertilize an egg. Millions of sperm are released during ejaculation. This large number increases the chances of successful fertilization, even if some sperm are lost due to leakage. The sheer volume of sperm ensures that there are still plenty left to make the journey towards the egg. Even if a large amount of semen leaks out, there are still plenty of sperm that remain inside the vagina. The remaining sperm are capable of swimming through the vaginal canal and reaching the cervix. This is a testament to their resilience and determination. These remaining sperm have a chance to travel to the cervix and potentially fertilize an egg. The journey of the sperm is a remarkable process involving navigation through the female reproductive system to reach their ultimate goal. Despite the challenges, many sperm succeed in this journey, making fertilization possible. Section 5. Sperm leakage and infertility, separating fact from fiction. Now, let's address the elephant in the room, infertility. Many people worry that sperm leakage is a sign of infertility. This is a common misconception. Sperm leakage itself does not cause infertility. As we discussed, it's a normal physiological process. Infertility is a complex issue with various contributing factors. These factors can include problems with ovulation, sperm quality, or blockages in the reproductive tract. If you are concerned about infertility, it's important to speak with a healthcare professional. They can assess your individual situation and provide appropriate guidance. Section 6. When to seek medical advice. Addressing potential concerns. While sperm leakage is generally normal, there are a few instances where it's a good idea to seek medical advice. If you experience any unusual symptoms along with sperm leakage, it's best to consult with a doctor. These symptoms might include unusual vaginal odor, itching or burning in the vaginal area, pain during sex, or abnormal vaginal discharge. These symptoms could indicate an infection or other underlying medical condition. Section 7. Cervical mucus and conception, a closer look. Let's shift gears for a moment and talk about cervical mucus. Cervical mucus plays a crucial role in conception. It's a fluid produced by the cervix that changes throughout your menstrual cycle. Around ovulation, your cervical mucus becomes thin and slippery. This consistency helps sperm travel through the cervix and into the uterus. Some people notice an increase in cervical mucus after sex. This is perfectly normal and doesn't necessarily mean you're not getting pregnant. Section 8. Lifestyle factors and sperm motility. It's worth mentioning that certain lifestyle factors can affect sperm motility. Sperm motility refers to the ability of sperm to swim. Factors like smoking, excessive alcohol consumption, and drug use can negatively impact sperm health. Maintaining a healthy lifestyle is beneficial for both partners' reproductive health. Section 9. The importance of open communication with your partner. Communication is key in any relationship, especially when it comes to reproductive health. Talk to your partner about your concerns and fears. Open and honest communication can help alleviate anxiety and strengthen your bond. Section 10. Taking charge of your reproductive health. Knowledge is power. By understanding your body and how it works, you can make informed decisions about your reproductive health. Don't be afraid to ask your doctor questions. They are there to provide you with accurate and reliable information. Section 11. Conclusion. Knowledge is power. In conclusion, sperm leakage after sex is a normal physiological process. It's not a sign of infertility or that you're doing anything wrong. Gravity, anatomy, and the natural self-cleaning mechanism of the vagina all play a role in sperm leakage. If you have any concerns about your reproductive health, don't hesitate to speak with a healthcare professional. They can provide personalized guidance and address any questions you may have. Remember, knowledge is power. By understanding your body and seeking accurate information, you can feel empowered and confident about your reproductive health.